So our next set of speakers are going to tell us a little bit about access to healthcare in the Bay Area. So I'll give them a second maybe to pull up the slides.
Should I share my screen now or?
Yeah, sure, go ahead.
Okay.
Yes, so it's my pleasure to introduce now Kiera, Yvette, and Jose, who are going to tell us about access to healthcare in the Bay Area.
Hi guys, good morning. Today we'll be speaking on access to healthcare in the Bay Area. I'm Yvette Morales and I'll be presenting the first few slides. Thanks, Kira. Okay, so this is just like a general outline of what you'll be seeing during our presentation. So first, I'm going to go over some background about the scores and the definitions that we'll be using throughout our presentation. So you'll be seeing HPSA and MUA/P scores. And then we're going to go into some deeper analysis about the Bay Area counties that we researched. So first we'll be talking about San Mateo County and a subsection of that being East Palo Alto. And then we'll be talking about Alameda County and specifically Cal State East Bay's position in Alameda County. And then we'll be discussing Contra Costa County and then a comparison of Contra Costa County with Los Angeles County. So all the data that we used during our research here is from Health Resources and Services Administration, also known as HRSA. And so we'll be discussing the primary care HPSA score, the dental care HPSA score, the mental health HPSA score, and the MUA/P score. So one of our first scores that we'll be discussing is the HPSA score, specifically the primary care one. It is based on a scale of 0 to 25 and incorporates the following components. Population to provider ratio, which implies the amount of people in an area to the amount of medical facilities, medical providers, doctors within the same area, and that is a max of 10 points. The percent of population which are below the federal poverty level, the infant health index, which is based on the higher score of the infant mortality rate or the low birth weight rate, which is a 5-point max, and then travel time to the nearest source of care outside of the HPSA designation area, which is how long it would take for a person that lives within a designation area to get to a medical facility or to medical care outside of said area. So the next score is the dental care score, which is on a scale of 0 to 26. And it incorporates the following components, which is population to provider ratio, yet again, the percent of population below the 100% federal poverty level, and the water fluoridation status, which is referring to how much fluoride is in the water that is being used at the dental care facilities. And then again, the travel time to the nearest source of care outside of the HPSA designation area. And then the next score is the mental health care HPSA score, which is based on 0 to 25 and has a few extra components that we haven't seen before, which is there's the population to provider ratio, yet again, the percent of population below the federal poverty line, but also the elderly ratio, which is the percent of people over the age of 65, the youth ratio, which is the percent of people under the age of 18, alcohol abuse prevalence, and substance abuse prevalence, which indicates the amount of, or how common it is for people to have alcohol and substance abuse obstacles, and the travel time to the nearest source of care outside of the HPSA designation area. And the last score I'll be talking about is the medically underserved area/population score, which is calculated on a 0 to 100 scale. an area or a population with a score of 62 or more is designated as a medically underserved area or a medically underserved population. So the score is composed of up to 28.7 points of a population to provider ratio. The percent of population which are underneath the federal poverty level, the elderly ratio, which again is people over the age of 65, and the infant mortality rate. So looking at San Mateo County, we see that the primary care HPSA is the only HPSA that is seen within the area. And the area that is medically underserved is East Palo Alto and a little bit of North Fair Oaks. And you can see in the map that all of San Mateo County is clean, completely medically served, or not medically underserved, I guess you would say. And East Palo Alto is the only area that is medically underserved. And then this is just medically underserved in general, not referring to primary healthcare. And it has a score of 58.8. And again, it's just the East Palo Alto area. And so here we're looking at the demographics of San Mateo County, which as we can see is predominantly white, has a large percent of Asian people, and also a fairly large Hispanic or Latinx population. But when we look at the demographics of East Palo Alto, we see that the Hispanic or Latino community is much larger. You're looking at a 64.1% Latinx population. And so here's just some general information about East Palo Alto. So East Palo Alto is the only medically underserved population in the county. East Palo Alto has a very large Latinx population, 66.1% versus the 24% in San Mateo County. East Palo Alto has a poverty rate of 13.1%, whereas San Mateo County has a poverty rate of 6.1%, and has a large population of undocumented immigrants. And when we look at the median incomes, we see a very large discrepancy, with San Mateo County having a $122,000 median income, whereas East Palo Alto is about $67,000. And so the areas surrounding East Palo Alto, like Palo Alto or Menlo Park, are known for being affluent and have greatly benefited from the tech industry. But East Palo Alto has not seen the same quality of education, housing, or healthcare. And due to the gentrification of the area, the rent continuously increases, and it is pushing many away from their East Palo Alto homes. So this is just something to think about when looking at demographics versus the very clear, you could even say like discrimination that is being seen in an area that is so highly populated with Black and Latinx bodies, whereas areas that are more predominantly white are getting treatment very different from areas that have a lot of POC bodies. Thank you so much, and I'll be passing it over to Jose. Thank you.
Hi everyone, my name is Jose Covarrubias, and I'll be talking about access to healthcare in Alameda County. So Alameda County is the 7th most populous county in our state. It has over 1.6 million people. It's the 20th largest, most populated county in the country. It has 18 cities, and it started to become a diverse county during the World War II era because there was a lot of job creation. It's also home to a lot of historical universities, such as Mills College, which is historically an undergraduate women's university, founded in 1852. So here's a map of primary care facilities. All the red dots represent a location. And the average score for that is 14.9. So remember the range of the score goes from 1 through 25. And the higher the score is, the more in need that location is. So as you can see here at dental health facilities, the average is higher, and most of the locations are concentrated near the Oakland area, and they're the ones doing the worst. There's several scores of 25, and then starting in San Leandro all the way to like Fremont, there's a huge gap where there's no need of these facilities. But then again, once you hit Fremont, um, they're doing really bad at it with a score of 25. And these are the areas for mental health. So again, as you can see, most of these locations are around the Oakland area. That's where there is the most need. And then again, huge gaps between like the San Leandro area all the way to Fremont. And even if you look at the east part of the county, there's not much need, just mostly around the Pleasanton area. So there's just a comparison of the HPSA scores and the health professional shortage. So as you can see, based on the average, the county is doing better with regards to primary healthcare, but they're doing worse in other areas like mental and dental health. And there's 12 facilities for each topic, like primary, dental, and mental. Um, that's really all based on need. I don't have a comparison right here, but for example, Santa Clara County has 8 primary care, 8 dental, and 8 mental, even though they have a higher population. But that's just because they are in significantly less need than Alameda County. So there's just a map of the medically underserved areas. Um, I know it's kind of funky, but the darker yellow are the areas that are in much more need. And again, they're mostly around the Oakland area, not necessarily Alameda City, because Alameda City tends to have a higher median and average income. And these are just some of the demographics of Alameda County. Okay, so income and poverty. So the median household income for Alameda County is a little over 85,000 as of 2019. There are approximately 8.9% of the people in our county living in poverty, and 5.9% of those people are still uninsured if they're under the age of 65. And there's several reasons for that. Some of them might be undocumented, therefore they don't have access to healthcare, or even if they qualify for the ACA subsidies, they still might not make enough to pay all the other expenses, so they choose to not get healthcare. And as you can see below, there's a graph, and that's just comparing the poverty percentage from different counties. Alameda's is higher than Contra Costa, San Mateo, and Santa Clara, which have 6% poverty, whereas Alameda has 9%. And now just to talk a little bit about East Bay. So our university was founded in 1957. As of 2019, there are over 14,000 students. And on the right side, you can see there's just a chart giving some demographics of our school. All right. So what services are available? Healthcare services are available to East Bay students. So it's built into our tuition. We pay $193 every semester. And with that, we have access to physicians, nurses, mental health, labs, pharmacy. However, that's not always enough. So if you go to the SHCS website, it should lead you to Pioneer Health. And there's information there where it'll guide you on how to apply for Medi-Cal if you're low income, you might possibly get it for free. If not, it'll direct you to Covered California, where it's a state's platform to shop for private insurance, where you will get government subsidies. And now I'll be handing it over to Kiara.
Hi, I'm Kiara, and I'll be covering Contra Costa County and Los Angeles County. So Contra Costa County is located in the state of California in the United States of America. The area codes of this county include 510, 341, and 925. Some cities in this area are Antioch, Brentwood, Clayton, and Concord. The county is also known as San Francisco's other coast. The HPSA and MUA scores. So the average HPSA score for Contra Costa County is 16.9, remembering that the scores are on a 0 to 25 scale. This is the average of the 10 scores found in this area, with the highest score of 25 and the lowest score being 12. So the map shows the primary care, dental care, and mental health care averages. The primary care is in green and it has an average of 17. The dental health care average is 23 and it is shown in purple. And the mental health care average is 13.2 and it is shown in blue. The average MUA score for Contra Costa County is 56.7, remembering that is on a 0 to 100 scale. This score is found on the data sheet that was previously mentioned. And the map just shows all the medically underserved areas that are in the county. So this is just a racial breakdown of Contra Costa County. As you can see, it is predominantly white with 65.1%, and it does have a good amount of Hispanics and Asians, so it's not as diverse, but pretty diverse. Housing in Contra Costa County, the median value of an owner-occupied housing units between the years of 2015 and 2019 is 625,800, which is kind of more expensive compared to other counties. So this is an income and poverty breakdown. There's roughly 7.9% of citizens living in poverty in the Contra Costa County. This is considered a low poverty rate for a county. The median household income is 99,716, and there is roughly 5.9% of citizens under the age of 65 who do not have health insurance. So now I will be discussing Los Angeles County. The County of Los Angeles is the most populous county in the United States. With more than 10 million inhabitants in 2018, the county has 88 cities that represent a dynamic and multicultural economy that has a diverse workforce and top universities. Los Angeles County has some of the most iconic landmarks in the states. So the HPSA and MUAP scores for Los Angeles County, the average HPSA score for Los Angeles County is 17.1, and the map just shows scores that are found in the county. And if you can see, it's much larger than the map that was shown for Contra Costa County because it's a lot bigger than that county. The average MUA score for Los Angeles County is 52.7. And this map also just shows the medically underserved areas in Los Angeles County. So it's similar to the map that was for Contra Costa County. So this is a race and population breakdown similar to the one for Contra Costa County. As you can see that it does have, Los Angeles County has a much larger percentage of Hispanics and African Americans. Los Angeles County is also known as a more diverse county than Contra Costa County. So housing in LA County, the median value of an owner-occupied housing units between the years of 2015 and 2019 is 583,200. and the median gross rent is $1,460, which is a lot cheaper than, a good amount cheaper than Contra Costa County. So there's roughly 13.4% of citizens living in poverty in Los Angeles County. This is a much higher poverty rate than Contra Costa County. So now Northern California versus Southern California. Different areas of California live differently. This includes the housing, income, poverty levels, medical expenses, or the number of healthcare providers to people, and etc. To get a better understanding of medically underserved areas in California, we will be comparing Contra Costa County, which is located in Northern California, to Los Angeles County, which is located in Southern California. So first we'll be comparing the HPSA scores and the MUA scores. So the difference between the scores of Contra Costa County and Los Angeles County is 0.2. This is not a large difference between the scores, meaning the amount of healthcare providers to the population of the county is very similar. The MUA scores between the two counties are also very similar. Los Angeles County is a much larger county with a population of 10 million. Contra Costa County only has a population of 1 million. Since LA County is much larger, this is an important factor when comparing the two. The poverty level in Contra Costa County is lower than LA County by 5.5%, but the cost of living in LA is also cheaper compared to Contra Costa County. To me, it's really important to look at how much bigger LA is compared to Contra Costa County, because it is a huge size difference, and it is pretty impressive that the numbers are still similar even though it's much larger. So that's all of our presentation. Thank you guys for listening. And if you have any questions, you can ask questions.
Thank you very much. And yes, so like Kiara said, if there are any questions.
Well, I can ask more questions. So, well, I'm just curious to get your guys' sort of opinion on this after having, done some research, like doing this kind of quantitative analysis of data that could impact, like, policy is sort of really taking off right now. And so, going through it, I'm just curious, like, what you guys, the same kind of question, like, what were the big challenges, and maybe, like, is it something you could, like, see yourself doing in the future? Or were you just like, nah?
If you were like,
okay.
maybe don't say it out loud.
Yeah. So I would definitely say that one of the biggest challenges in looking at all of this was not even so much the actual research, but kind of just finding out what you already know, that it's whatever, areas that are highly populated with people of color are often overlooked and underserved. So it was kind of just mm, this, it's good to know, but it's what could we do to make it better? And it's kind of leaves that in your head lingering, that it's this was kind of just difficult to look at the numbers and reconfirm what you already knew. So I would say that was probably one of the biggest challenging things for me, especially as somebody who, I'm a biology major, who originally was thinking medical school, but with all of our politics in the world right now is leaning more towards law school, and thinking about what policies and what things could be put in place within the government to fix these really honestly terrible discrepancies and systems. So yeah, I would say that was probably the most challenging thing.
It was difficult to find some data sets, especially because we tried using the data census website, but it hasn't been updated. Was thrown off a little bit by COVID. And then other data sources, it wasn't really easy to get access to them. So that was another challenge, finding the right website to get the data from.
I'll have to agree with Jose. It was really difficult finding data, like we knew obviously that like people of color were less underrepresented, like Yvette said, but it was difficult finding data to support what we already knew. And if we did find data, it was kind of difficult finding raw data instead of just using their numbers, like wanting to come up with our own numbers was difficult. But I am really interested in healthcare and I do like math. So it is something that I am pretty interested in, that I can see myself being more interested in later on.
Awesome. So yes, thank you very much. And we'll take maybe another minute here or so. Oh, actually, I think Dr. Glass has a question maybe. Her hand is up. Yes,
Yeah,
Dr.
thank
Glass.
you. Thanks so much. I'm sorry I had to come in a little bit late, so I just caught the tail end. I really enjoyed it. And I guess my question is did you feel like in examining the data, you had ideas about how to present arguments to people who might be skeptical? I felt like you felt like the data you found reinforced what you already know in your lived experience. But there are people who disagree. And so I was wondering whether you sort of thought, oh, here's a way to make a persuasive argument to somebody who might disagree with you.
I would say that looking at the data in multiple areas is like a really strong way of presenting it, that this is not a one shot in the dark type of thing. It's very clear that this is across the board. And I think if we would have expanded to like more counties and more like just all throughout California and all throughout the country, would have seen the same exact pattern like throughout. So I would say definitely that would probably be my strongest point of saying like, let's really look at what we're like finding in this data, and let's look at it over more than just one county, multiple counties, even states, because you'll see the same pattern like continuously.